At 8:10 this morning, the coronavirus is affecting a growing number of countries. And this morning, the U.S. is warning Americans to prepare for the flu-like virus to spread here.
Several companies are working to develop a vaccine now. The first clinical trial of a possible treatment is happening right now in the U.S. Meanwhile, international health officials say more than 300 cases are confirmed in Italy. The CDC is saying you should avoid non-essential travel to South Korea because the virus has infected nearly 1,000 people there. So this morning we are taking your questions straight to the folks at Lee Health. We have Amy there talking to some physicians about the coronavirus and the flu, answering your questions. So what do we have next, Amy?
All right, we have a lot of good questions coming in, Lisa, and Dr. Stephanie Stovall's here this morning to answer everyone's questions. If you want to, you can join us live on Facebook as well. We're having an ongoing discussion about not just the flu, but coronavirus. And I want to get to Beverly's question because she and one other woman say they're going on a cruise. One is in Hawaii, one is in the Caribbean, and she's asking, is this a smart thing to do right now? Because we have seen in recent news, obviously, what happened on a cruise ship with coronavirus spreading. People are concerned about travel. What would you say?
So at this point, it's geographic as far as travel advisories. So the CDC puts out travel advisories. You can go to their website and you can see their travel advisories. To my knowledge, there is no travel advisory for those two particular areas at this point. So assuming you're not boarding the cruise ship in one of the travel advisory areas like China, then it's not recommended that you would cancel your trip. That being said, we always worry about enclosed spaces. So if you're on a cruise ship, you need to be completely aware of the things that you're touching and completely aware of the things that are going into your mouth, going into your eyes, going into your nose, because that's how things are going to be transmitted, whether it's coronavirus season or flu season or neurovirus season. All of those things can be transmitted easily when we have a lot of people close together. So is it a smart idea? I can't say it's not a smart idea. We all like to vacation, but at this point, we don't have any reason to suspect it's any more at risk than it would have been last flu season to travel to those areas.
I hear this question a lot. Is this, Gayla Lawrence is asking, is this virus a scare tactic by Big Pharma to boost sales on future vaccines or treatment?
The COVID-19 virus? No, we're definitely seeing people with this virus. It's definitely new. We have the genetic makeup of this virus. And so, no, this is very much a real thing. And we've certainly seen this happen through the years. There are at least 2 other coronaviruses that have emerged like this. So this is a known entity that happens. It's truly just science.
Yeah, and it's something to be aware of. So again, we are live on Facebook all morning long. We are taking your questions there. If you want to hop onto Facebook Live with us right now, we'll continue to answer questions. And we will also continue answering questions here on Fox 4 Morning News. Keep them coming. They're great. And Dr. Stephanie Stovall, thank you so much. And we'll be back answering more questions in just a bit.